Welcome back. September is National Recovery Month, and joining us now to talk about it is Jim Fraser from our sponsors at Horizon Health Services. Thanks so much for coming in, Jim.
Thank you for having me.
Of course. I want you to start off by telling us about the important work you do with patients, peers, and those navigating mental health and substance abuse disorders.
Absolutely. So one of the services that Horizon has is peer advocates. And peer advocates are individuals who have lived experience, who directly work with our patients for mental health and substance abuse. So these are individuals who are working alongside the counselors, and they're really able to offer their own experience, strength, and hope, and offer insights and skills that they learned along their recovery process to help our patients become more successful with reaching whatever goals they have. So there's 3 different types of peers. You have mental health, substance abuse, and family. And the mental health and substance abuse peers are individuals who have lived through that experience themselves and gone through treatment. And then the family peers are individuals who work with the family members of our patients. So sometimes family members need support as well.
Right.
And so that's where they come into play. And it's such a phenomenal service.
Makes sense. Okay. Do you want to talk about what are some of the barriers that you see as to why people don't or can't reach out to help for more help?
Yeah, absolutely. So there's still a lot of stigma when it comes to mental health and addiction, right? I think as a society, we have grown and we've gotten better. But at the same time, there's a lot of guilt and shame when it comes to asking for help. Right? Think about it just like even in your everyday life. No one wants to ask for help, right? You want to be able to do things on your own sometimes. But at the same time, people need that support. They need a place where they can go to learn the help that they need to get better. And so peers, that's really where they come into play. They can share their own trepidation, their own experience with how they were nervous about coming into treatment. They can talk about how they overcame those stigmas. And so that's where the peers can really help those people who are just struggling with, how do I get into this?
Right. Horizon Health does a lot of education, and I want to know why it's so important to raise that education and awareness around substance abuse and mental health treatment and make it such an essential part of our community.
Yeah, absolutely. So realistically, if you look at who's getting treatment, most individuals don't feel like they're getting adequate support. So roughly 40% of individuals who are struggling with addiction feel like they don't have the support they need to be successful, which is crucial, right? I mean, that's almost half the individuals don't feel like they're getting enough help. And so when we can have conversations like this, where we bring kind of what I do to the mainstream, right? We can bring mental health and addiction outside my field, but put it into the main conversation, the main idea of what we're looking at, and let people know that this service actually exists. A lot of people don't realize that you can get a peer support. Most people think that if you go to therapy, you're just working with a clinician, maybe someone who's gone to school, they have a master's, they're working as a therapist. They don't realize that you can get an individual who's been through the same experience, been through the same process, and they can kind of help guide you through this.
Right.
So just simply talking about this raises the awareness. It lets people know that Horizon exists. Sometimes when I tell people who I work for, they go, oh yeah, Verizon, I've heard of them. I have their cell phone plan.
Yeah.
And so letting people know that, Horizon exists. They've probably driven by one of our 14 clinics in Western New York, right? They're all over, but they don't always know what that really represents.
Right.
So this is a phenomenal opportunity.
Well, Jim, I want to ask you what recovery means to you.
Yeah, so on a really simple level, recovery just means overcoming an obstacle, right? You can be in recovery from anything. You could be in recovery from maybe a poor eating habit. But on a much bigger level, recovery really means something much more incredible. Recovery is learning how to evaluate your life, look at what you like and dislike about it, and then being able to have the skills it takes to create change. So recovery from mental health or addiction is a phenomenal thing, because not only are you overcoming the addiction piece, but you're also learning how to take control of your life and change anything about it. Right? Let's think about New Year's resolutions.
Right.
So many people want to lose weight, right? January 1st, the gyms are filled, everyone's going to eat healthy. But often most people don't stick with it, right? February comes around, the gym's a bit of a ghost town. And what you learn from recovery, and what recovery really means for me, is learning how to create a change in your life that's consistent, that's something that you can stick with, and then ultimately you get to create a life that you genuinely enjoy and are happy with. And that's and that's priceless,
It
right?
is.
So many people are missing out on that.
Jim, you and Horizon Health are doing incredible work in our community. Thank you so much for coming in and sharing more. Viewers, if you would like to get in touch with our sponsors at Horizon Health Services, you can visit their website at horizon-health.org or call the number right there on your screen. Thanks again for coming in, Jim.
Thank you for having me.